Assalamualaikum and good afternoon. Thank you to each and every one of you for being here with us at the live session from MAHSA University, Sarjana Putra Campus. I am Siti Aisyah Munira from Faculty of Health Sciences, MAHSA University. Today's webinar, Bone Densitometry, is proudly brought to you by the Faculty of Health Sciences, MAHSA University. Dear viewers, before we proceed further, I would like to give you a brief overview of the programs offered by the Faculty of Health Sciences, MAHSA University. In our Faculty of Health Sciences, we have 3 programs, which is School of Physiotherapy, second, Department of Environmental Health, third, Department of Medical Imaging. Under School of Physiotherapy, we have Diploma in Physiotherapy. We also have Bachelor of Physiotherapy Honours, Bachelor of Physiotherapy Honours ODL mode, which is Open Distance, Master of Physiotherapy. Under Department of Environmental Health, we have Diploma in Environmental Health, Bachelor of Environmental Health and Safety Honours, Bachelor of Environmental Health and Safety Honours ODL mode, as well as Diploma in Occupational Safety and Health. For Department Medical Imaging, we have Diploma in Medical Imaging, Bachelor of Medical Imaging Honours, Bachelor of Medical Imaging Honours ODL mode. Why you need to join health sciences? First is because of high job demand, because we provide essential services to the country. Second, no boring work routine, because every single day we meet different people and we also work in different situations. The creative combination makes your hard work pay off. Low risk of job redundancy means that essential services cannot be automated. High opportunity to work in variety of settings, for example, clinical setting, industrial settings, as well as academic settings. A career that you can feel good about and talk to your friends regarding health sciences. Master of Physiotherapy, we offer 2 programs, which is 1-year program full-time and 2-year program which is part-time. And this is entry requirement for Master of Physiotherapy, which is bachelor degree with the minimum CGPA of 2.5 CGPA. If the minimum CGPA is not achieved, then the candidate requires to have a minimum 5 years working experience in their related field. For bachelor's program, this is entry requirement. If you have questions and would like to know more regarding the entry requirements, please visit our website, which is www.mahsa.edu.my. Diploma Physiotherapy, Diploma in Environmental Health, Diploma in Medical Imaging. Entry requirement. Also, for more details, please visit www.mahsa.edu.my. Diploma in Occupational Safety and Health, we have 3-year programs, and this is also their entry requirement. MAHSA University and Internet Excellence is what MAHSA aspires to provide each of its graduates. Why you need to choose Faculty of Health Sciences MAHSA? This is because we provide many benefits and advantages in terms of learning and teaching. We have experienced and dedicated international pool of academic staff which can help you throughout your study journey. We also have various study modes, for example, conventional and open distance learning. Course teaching by the experts. Interactive teaching emphasizes on hands-on and clinical skills throughout face-to-face and online platforms, for example, LMS. For clinical and industrial placement, we have wide list of hospitals and institutions that can help students to experience the clinical and industrial experience. Our program is also accredited by MTA and JPA with the international recognition, for example, dual award with ARU. Regarding the financial issue, MAHSA also provides several number of scholarships. For example, we have Haji Abdullah Academic Excellence Scholarship, Foundation Scholarship, Blue Ribbon Scholarship, School Teachers, Family, as well as the Single Parent Scholarship. To improve the excellency of their study in MAHSA, we also provide collaboration and affiliation with international university and also a few regulatory bodies. For example, we have student mobility program with the Sophie University, with the lovely professional university, as well as with the University of Sriwijaya. Therefore, we welcome you to join us. If you have any questions regarding our Faculty of Health Sciences, please contact us through MAHSA website or please go through our faculty Facebook page to know more about our program. Or simply leave a questions and comments. We will get back to you. Your question concerning this webinar session can be listed in the chat box below. Before we go in deep regarding our webinar session today, let me give you a brief overview regarding webinar topic today, which is bone densitometry. Bone densitometry is called dual energy assay oximetry, DEXA or DEXA, which uses a small dose of ionizing radiation to produce images, especially at the lower limb. These images is used to measure the bone loss. It is non-invasive procedure that used to diagnose osteoporosis as well as to assess individually for osteoporotic fracture. This webinar will focus on the preparation, equipment, and technique to measure the bone mineral, which is calcium, as well as the density of the skeletal site and the whole body. As to give more detailed and in-depth knowledge regarding bone densitometry, I would like to introduce an expert in the bone densitometry, which is Ms. Nadia. And beforehand, I would like to give a brief introduction who is Ms. Nadia. Ms. Nadia holds a Master of Science in Radiation and Nuclear Safety from University Kebangsaan Malaysia, as well as Bachelor of Science Diagnostic Imaging and Radiography. She has started her career as a radiographer since 2005 and has been actively in education for more than 15 years. What a great knowledge and experience she has. So without further ado, let me welcome Ms. Nadia to the scene.
Hello.
Hi, Assalamualaikum Ms. Nadia.
Waalaikumsalam.
How are you all today?
Okay, very fine. How are you?
Yeah, I'm fine too. Alright. So I already give a brief introduction who is Ms. Nadia. So without further ado, and I will not waste time. So I will invite Ms. Nadia to present her webinar. So Ms. Nadia, the scene is all yours.
Okay, all right. So thank you, Miss Siti Aisyah Munira, for the very kind and long introduction about me. Seems like I have a very great experience, but actually I'm just here to share some knowledge and hopefully can create a little bit of awareness on bone density as well as bone densitometry today. So let's not waste everybody's time. So before that, I would like to introduce myself. I'm Nadia Kamal. So let's go through the slide. Okay, so as an introduction, what is bone densitometry? It is actually a scanning that uses the X-ray as a source to scan and measure the bone mineral or the calcium, also known as calcium. And from the measurement, we can see and we can calculate the bone loss and the bone density at specific skeletal sites or the whole body. So the examination is also called as DEXA Scan, or some can also some does call it as BMD measurement. BMD actually stands for bone mineral density. Okay, so moving on, DEXA is some call it DXA, some call it DEXA. DEXA actually stands for dual energy X-ray absorptiometry, which is usually performed in the lower spine and hips. So there are two types of DEXA machine or DEXA devices. One uses the X-ray and another one uses the ultrasound waves. So these machines can measure the wrist, the finger, or heels, and sometimes these two devices are used to for screening purposes of the bone. Both as the introduction already explained, the bone densitometry scan measures the calcium content in the bones where we cannot actually evaluate it in an ordinary x-ray. If you just go for a routine x-ray, a chest x-ray, like when you go for a routine checkup, you cannot measure or calculate the bone mineral, but you have to go and perform a specialized scan where we call it now as DEXA. So the X-ray serve the purpose to detect a recent bone fracture, but on the other hand, DEXA serve the purpose to actually predict the possibility of fracture. Okay, so let's go a little bit to the history. Osteoporosis remained undetected and overlooked until 1920. The first publication about bone mass appeared in 1930s, and after 50 years, about 57 years, so now the first commercial DEXA, DEXA scanner was introduced, but during that time they used radioisotope instead of X-ray tube. Nowadays we use X-ray tube to produce X-ray for DEXA scan. Okay, so osteoporosis, I think most of us has already hear or listen, know the word osteoporosis, as when we on the television, there's always advertisement on the milk that talks about osteoporosis all the time. So osteoporosis literally means porous bone. So where porous bone means you have gradually lost the bone material and your bone becomes more fragile as compared to the healthy young adult. So when your bone becomes more fragile, it is more prone to fracture or more prone to be break. So on the medical definition, a little bit on the medical perspective or definition of osteoporosis, it is actually defined as a skeletal disorder which is characterized by compromised bone strength. So when your bone strength is compromised, at the end of the day, you have increased risk of fracture. Okay, let's talk about osteoporosis in Malaysia. So across the globe, there is an increased occurrence of osteoporosis due to the gradually decline status of bone mineral density. So there is a study done in Malaysia. They have reported that in 2000, the year of 2000, there were 1.4 million cases of osteoporosis reported by MAHSA in the year of 2000. And into the year of 2050, which is around 28 years from now, so they expect the increase of osteoporosis cases to 3.3 million. There will be a triple increase of the cases. So Malaysia has higher prevalence rate of osteoporosis, which is reported by Lim et al. 2005 with the percentage of 24%. So that is quite high. So this is how the appearance of healthy bone as compared to osteoporotic bone. If you can see the porousness of the osteoporotic bone, you can see more holes by appearance if as compared to the healthy bone on the left side. Okay, these are the stages. If you can see on the left hand side, this is the healthy young, not necessarily young, a healthy bone. In the middle one, you have osteoporotic bone. And on the right, the most right hand side is the severe osteoporotic bone. So the holes become bigger and bigger. The porousness become bigger, severe and severe. Okay, let's talk about the use of DEXA. So DEXA is used to diagnose osteoporosis and also to assess the risk of bone fracture within next few years. So it is said that if you perform a DEXA scan, you can actually predict the probability of getting bone fracture within few years. Osteoporosis usually affects the menopause after postmenopausal women, but we cannot deny the fact that there are also men that suffers osteoporosis. So when you suffer osteoporosis, you have gradual loss of calcium, where your bone become thinner, more fragile, and also more likely to break. And this is different as compared to arthritis, which is the form of inflammation of the bone. Other than that, DEXA is also effective to track the effect of treatment for osteoporosis. If you have already been diagnosed with osteoporosis, then you go for treatment, and after that, DEXA can also see the progress of the treatment. Um, if let's say you have already undergone for the osteoporosis treatment, so after 2 years, the DEXA scan can be repeated to see the progress of the treatment. This is what is recommended widely. So let's talk about the risk of osteoporosis in women. So the women who are menopause, having family history of osteoporosis, you have already experienced small bone fracture, advanced age, having low calcium diet, like what we Malaysian, most of the Malaysian are inactive lifestyle, like the Malaysian also, and who the cigarette smokers, having gastrointestinal malabsorption problem, and those who are undergoing medication like corticosteroid. These are the risk factor for osteoporosis women. Okay, so the recommendation by the World Health Organization, they agreed that the women aged 65 and older should have their bone density tested if they experience height loss. Suddenly you become shorter, history of vertebral fracture, and also if you are on the long-term corticosteroid therapy, they recommend you, if you are 65 years old, get a DEXA scan or bone mineral density scan. Okay, so the indication for bone densitometry, so the women who are postmenopausal, who are not on estrogen, so you are indicated to go for a bone densitometry scan. The women who have personal or maternal history of hip fracture or smoking, men with clinical condition that is associated with bone loss, person who are under medications such as corticosteroid, prednisone, anti-seizure medicine like Dilantin, or in high dose of thyroid replacement drug, patient having type 1 diabetes, liver disease, kidney disease, family history of osteoporosis, condition like hyperthyroidism, parathyroid condition, and the patient who experienced fracture or after a mild trauma, you are all indicated for bone densitometry test. Okay, so how does the procedure is performed? So the scan usually takes about between 10 to 30 minutes. The whole examination might take 30 minutes, but usually the scan only takes around 10 to 15 minutes, depending on where the scan is and the equipment used. You are not required to fast. You can eat normally before the test, but if you are under the calcium supplement intake, you might withhold the calcium supplement for 24 hours before the examination. Wear a very loose, comfortable clothing, and try to avoid garments that have zippers, belts, or buttons. But usually, if you go for a scan, they will ask you to change into the hospital gown. And make sure during the scan or during the procedure you have removed all the metallic object, jewelries, glasses, or any metal object, because this type of object actually interferes with the X-ray images. If you're pregnant, please notify the radiographers or the technologists. And let's say if you have already undergone an X-ray examination that you have been administered with contrast media or barium examination, you have to also tell the technologist or radiographer, because you have to wait for 10 to 14 days before you can undergo the DEXA test. Okay. All right. So type of bone densitometry test. There are two types of tests. We have central device and peripheral DEXA. So the central device measures the density of the bone of hip and also spine, and it has a very large table with arm, and there's a suspended overhead arm. For peripheral device, there are a smaller types of gadget where you can bring it if you're having a health fair. So you can bring around, it's portable. And this type of device can measure the bone density in the wrist, in your wrist, heel, and also finger. So these are the differences between central. Central works centrally, peripheral works peripherally. Okay, this is the central DEXA machine. So as you can see, there's a big table here. So the patient will lie on the table, and this arm will move around during the scanning. Okay, so the DEXA machines actually produces or send a very thin beam. So this thin beam has two energy peak. So these two energy peak will pass through your body, and one peak of energy will be absorbed by the soft tissue, and another peak will be absorbed by the bone. So after the scanning, when the images comes out in the monitor, we can subtract or we can filter the soft tissue part and only focus on the bone part, where the software will start to calculate the bone mineral density. And this is done by the computer anyway. Okay. So what happens in the central DEXA examination? So you lie on the table. Just now I've shown you the table. So X-ray generator will be located below you, and there's an imaging detector or imaging device located above you, and these two will move parallelly during the scanning. And usually when you lie down on the table, your leg will be raised and it will be supported by a very large pad. So the purpose of raising your leg and support it with a very large pad is to make sure that your pelvis and the lower back is flattened during the scanning. For the hip scanning, so the foot is placed in the brace, where this brace helps to rotate your hip inwards. So in both cases, the images will be produced in the monitor, and you have to remain still during the scanning, which doesn't take long. And sometimes you might be required to hold your breath for a few seconds during the scanning procedure. So the purpose of holding the breath is to reduce the unsharpness or the blurring of the image. Okay, all right. So during the DEXA test, this is how you are going to be positioned. You'll be lying down on the table, and this arm will move around you. And this is the large padded box that I told you just now. Your leg will be raised and positioned on the padded box. And after that, the images of hip and spine will be taken. Okay, this is another examination where we do a lateral vertebral assessment. So the lateral vertebral assessment actually screen for vertebral fracture, and this is also performed in the central DEXA machine. Okay, sorry. Okay, this is a peripheral DEXA machine, a smaller one, a portable one, where we can scan the finger, the hand, forearm, and heel, where you put your the part that we want to scan inside a small device, and the bone density reading will be produced in a few minutes. Okay, so aftercare for the procedure, because after the procedure, you actually there's no special type of care. You can resume the normal diet and the normal activities unless you are required to do otherwise by your physician. Okay, so what does the test result tells you? So bone mineral density is compared in two ways. One is Z score, another one is T score. So this Z score and T score differs from statistic t-test and normal distribution. So the T score actually compare the result with healthy young adults. Okay, if you're undergoing the bone densitometry test, your result will be compared with the healthy young adults. But if you're talking about Z test or Z score, the score will be compared with the result from the people who are in the same age group with you and the same gender and the same race. Okay, for the T score, they calculate the standard deviation between your BMD and the healthy young adults. So there are two types of result. One is positive T-score and one is negative T-score. So positive T-score indicates the bone is stronger than normal. So everybody wants a positive one, right? So the negative T-score will indicate that your bone is weaker than normal. So negative one is, however, although negative says that your bone is weaker, negative one is still considered normal. Negative 1 to negative 2.5 is classified as osteopenia, which is the first stage of bone loss. Anything below the negative 2.5 is considered as osteoporosis. So let's not go there. Okay, so this is how the test result looks like. You have the scout images. So from the scout images, the software will calculate the bone mineral density, and you'll get a graph like this. The computer will help you to plot the graph like this. So the green one shows the normal score, normal bone. And anything lower than negative one is osteopenia. Anything lower than that is osteoporosis in the red zone. So you have one lumbar image here and another one hip image here. Okay, so how about the test result, or the risk from the test result? So the risk for bone fracture actually doubles with every standard deviation, SDE standard deviation. So if you get a score below normal, let's say a T-score of -1, so you will have double or twice the risk for bone fracture if compared to a person with normal BMD. So a person that have T-score of -2 will have 4 times the risk of bone fracture as compared to the person with normal BMD. Okay. All right. So the Z score is the number, the score that reflects the amount of bone that you have in comparison with the people within the same age group, of the same gender, same race, same height, and same weight. So if, let's say, you have performed the BMD and you get unusually high or unusually low score, so this will indicate that you need to go to undergo a further medical test to see the condition of your bone. Okay, so what are the advantages of bone densitometry or DEXA? So bone densitometry is a simple and quick and also non-invasive. There's no injection takes place, no surgery. You just have to lie down for a few minutes, then the scanning will be performed, then you're off. And then it has a very low radiation dose of 1/10 of chest X-ray, no anesthesia, This is the most accurate method. If we go through some of the study, they say that this is a gold standard to assess the bone mineral density. There's a wide availability of DEXA scan, ease of use, short period of scan time. We can get a high resolution image with good precision. So these are the advantages. And I'm going towards the end of my presentation or my webinar. The limitation of DEXA scan, if we compare between central DEXA and the peripheral DEXA, central DEXA is more sensitive, but of course, the cost is a little bit expensive than peripheral DEXA. DEXA actually cannot predict who will experience fracture, but it can provide indication or relative risk of fracture. The people who perform or undergo the peripheral DEXA, if you scan the heel or the wrist, this help to predict wrist fracture in the spine or hip. But because the bone mass tends to vary from location to location, sometimes the measurement in the heel will not be as accurate as measuring the spine of hip or hip. Okay, as a conclusion, the bone densitometry can be used as a diagnostic tool, and it will continue to expand as the technology advances, and it will be complemented by improvement in the osteoporosis management. So osteoporosis is a silent disease. You might not know you have it until you break a bone. So before you break a bone, if if you're within the risk group, or if you are indicated to do so, go for a scan to the nearby centers, get your appointment, so that we can try to reduce the risk of fracture. With that, I conclude my sharing today.
Alright, thank you, Ms. Nadia, for your insightful presentation, and it is very interesting to know about bone densitometry. Dear viewers, if you have any questions to ask Ms. Nadia regarding bone densitometry, please leave a comment and I will read your question to Ms. Nadia. Alright, so we have one question, Ms. Nadia. We have one question from Sati Ganesh. He's asking you, how much does a bone densitometry cost in Malaysia?
Okay, all right. Thank you for the question, Mr. Sasi Ganesh. He looks young, so he's not indicated for DEXA scan yet. But anyway, DEXA scan within the Klang Valley will cost you around 200 to 400. That is within Klang Valley.
So around 200 and 400. Alright, thank you for the first question. Next, we have is there any the second question we have? Alright, yes, we have the second question from Raja Fatiha. Okay, Raja Fatiha is asking, Miss Nadia, is there any weight limit for the patient undergo DEXA?
Okay, so for the DEXA exam, there are some manufacturers that already set the weight limit of the table between 300 to 500 pound, and the patient heights of 6 feet. So basically, people who are under 300 pound will have no problem of undergoing DEXA scan. But if for those obese who go up to 300 to 500, they might have a problems of getting on the table because of the weight limit of the table. And sometimes because we use a very low dose x-rays, the scanning might not give you an accurate measurement of the bone mineral because of the thick soft tissue. Thank you, Raja Fatihah, for this question. Anyway.
Alright, thank you also Ms. Nadia for the question. Hope that Raja Fatiha is satisfied with the answer given by Ms. Nadia. Alright, Ms. Nadia, I have one question from myself. Okay, from your presentation just now, you mentioned that there's a lot of like indication for persons who need to undergo for bone densitometry. My question is that why person with smoking history highly suggested for DEXA?
Okay, all right. Thank you for the question, Miss Moderator. So, as we know, smoking actually has the risk for a lot of things. So, the content of nicotine inside the smoke or the cigarette actually increases the risk of bone loss. So once nicotine enter the body, it interrupts the regular bone regeneration process. So when it interrupts the bone regeneration processes, it might cause or increase the risk of osteoporosis, and that's why smoking has been listed as inside the risk or indication for bone densitometry.
Alright, thank you, Ms. Nadia. So it means that smoking is very bad for our health and it can cause osteoporosis as well. So that's why we need to stop smoking.
Yeah, bad but nice. So very difficult to stop.
Alright, I understand that. Alright, so for the audience, I would like to give a gentle reminder to you to fill in the survey form, which can be found at the comment section at the end of this webinar, so that the e-certificate will be awarded for you. Alright. Alright, so we have another question from the audience. So from Rusul Musab, she asking you, can we also use CT scan for DEXA?
Can we use?
Alright, I will repeat the question. Can we also use CT scan for DEXA? Means that to measure the bone density?
Okay, all right. Thank you, Rusul Musab. There is we can actually use CT scan to assess, not CT scan for DEXA, CT scan for measurement of bone mineral density. Yes, we can use. And some of the study actually recommends that if you undergo the CT scan for abdomen and pelvis, you can concurrently do the bone mineral density measurement together with same examination, where we actually do not expose twice. As we scan, you can actually opt for the bone mineral density calculation with no additional radiation, and also you get a three dimensional images. So yes, we can use CT scan to do bone mineral density measurement.
Alright, thank you, Ms. Nadia. So hopefully the answer given by Ms. Nadia already satisfied the question by Rusul Musab. So I think we don't have any more questions regarding bone densitometry. So so as people always say, in every meeting we also have the ending. So sadly to mention, we have come to the end of today's session. So thank you so much, Ms. Nadia, for joining us today and provide a very thoughtful information regarding bone densitometry. And I also hope the audience who asked the question already satisfied with the answers. And then, without doubt, having you today, Ms. Nadia, really give us a beneficial knowledge regarding bone densitometry. Thank you once again.
Okay, welcome.
And then to our wonderful audience, thank you for joining us at this webinar. We are looking forward for your comments to improve our webinar, and your participation in our future event hosted by MAHSA University is highly appreciated. And for the final gentle reminder, please fill in the survey form that can be found at the comment section by the end of this webinar, so that we will provide you with these certificates. In case of you have any further queries, you can contact us through MAHSA website or visit our social media. With that, please have a nice day, everyone, and thank you, Ms. Nadia, once again.
Yeah, bye bye. See you.
See you again.